Hey, good afternoon, everybody, and welcome back. This is the Gathering to Promote Suicide Prevention Among American Indian and Alaska Native Service Members, Veterans, and Their Families, webinar learning series number 3. Next slide, please. Again, just welcoming everybody back into this. I hope you've been tuning in the last couple of series here. My name is Dean Dufresne. I'm an enrolled member of the Turtle Mountain Band of Chippewa Indians. Also have roots in the Spirit Lake Nation in North Dakota. I'm a Marine Corps veteran, and I am honored to be doing this work with you all today and joining as we get into this third part of our series. Next slide, please. I have the pleasure of introducing the man, the myth, the legend himself, Hunter Genia. He's a dedicated behavioral health expert and advocate with over 29 years of experience in social work, mental health, and tribal advocacy. And Hunter, I'll turn it over to you to do your own introduction as well. Thank you, sir.
All right, thanks, Dean. Appreciate the humor and shouldn't expect anything less from you. So, my Ojibwe brother from Minnesota, North Dakota area. So, um, good morning, Minogajep, or another way of saying it is Minnow Wabun. And I wanted to use that because a couple of our presenters are from Wabanaki. And in our Anishinaabe language, um, our creation story, we migrated from Maine down and settled into the Great Lakes area as Anishinaabe, Ojibwe, Onodawa. And Wabun, where I come from, means morning. And so when I say Minawabun, uh, that's another way of saying good morning to all of you that are coming from other parts of the country that it's still morning time. And otherwise, Minogajep, Minogijigut, to everybody. And I wanted to, when Jay asked me to, if I would be willing to do the opening, it's not something that I take very lightly. Um, and as many of you, like myself, I am a descendant of federal Indian boarding school survivors and a sibling to Catholic Indian boarding school attendees. And I share that because, and I appreciate SAMHSA. One of the things that SAMHSA published was a document called "To Live to See the Great Day That Dawns," and it's a suicide prevention resource book. But in there, they acknowledge the historical trauma that happened, what we call the United States, and I share that because in my lifetime, and I might be a few winters old, but it wasn't until my lifetime that the United States overturned a federal Indian policy that outlawed the practice of our culture, of our traditions, of our ceremonies, in our language. When in 1978 they passed the American Indian Religious Freedom Act. So while the rest of the country were enjoying those rights, our people were still under the rule of laws that we were not to be treated equally. And I share that because, we have all warriors and veterans that are on here and that are part or servicing our American Indian veterans, servicemen, and warriors. So, I wanted to acknowledge all of you that are protecting the rights and the freedoms of all of our United States citizens, regardless of race, color, creed, or religion. And I know that's something that social justice is something very important to me to never forget our history and where we come from. I belong to a tribe that's been federally terminated by the United States government, and we're trying to return our tribe back to the list of federally recognized tribes. So the fight still goes on, and I appreciate all of you that are protecting the rights and freedoms of all of our people and those that you made treaties with. So I'm going to just share a few words in the language in honor of my grandparents and all of our ancestors who this was our first language at one point in time. So Ani Bojo and Gyusa Nin and Indigenous cause Wabajan Shido de Mount Pleasant, Michigan Ming Nadida Minwa Grand Rapids, Michigan Ming Nadojaba Saginaw Swan Creek Black River Band Ojibwe Minwa Grand River Band Odawa Anishinaabe and Dow Kuchimigwech Gije Menado Kuchimigwech Gimiji Yong Kinigego Kuchimigwech Gimiji Yong Minwa Bene Shiwok Minwa Nimbe Minwa Mishkeki Ake Minwa Wesino Kan Minwa Okanok and Chimigwech for the Gichida or Jigana Shuk Chimigwech the Mino Gijigat Apchugo Nima da Gi Mino Bimanazida Akina. So I just announced myself to the creator in our language with my spirit name and my clans. That's how creator recognizes me. And so we were taught when we pray to do it in our language, and that we shouldn't be afraid to use our language anymore. So I just want to share those few words with all of you and wish the panelists an awesome presentation. I know that you will be providing information that will benefit all that are listening here today or will go back and listen to the recording. So Chimigwech, and I'm going to turn it back over to Jay and Dean, and thank you for the honor of opening up this webinar today. Nahal, Chimigwech.
You, brother Hunter, appreciate you, man. Thanks for everything you do. Next slide, please.
All right, welcome in, guys. So, so grateful to be co-leading this effort with Dean. We are at our third webinar, and it has been such an amazing time to hear the stories, to hear the work that's happening, and all of the transformative efforts to push this effort forward in hopes to reduce suicide in Native service members, veterans, and their families. And so, as we go through, of course, the views, opinions, and content expressed in this presentation do not necessarily reflect those of the Substance Abuse and Mental Health Services Administration, the United States Department of Health and Human Services, VHA, or VA. Next slide.
Okay, these are our learning objectives today. For today, we're looking to expand the knowledge of American Indian Alaska Native suicide prevention best practices, military culture, and available resources. Also looking to inspire culturally responsive practice improvements and innovative approaches to American Indian Alaska Native suicide, SMVF suicide prevention, and building participation and capacity by sharing practical tools, frameworks, and real-world examples that support effective implementation of AIAN SMVF suicide prevention strategy. Next slide, please.
Taking a look at today's agenda, we've had an amazing opening. Thank you so much, Hunter. And we'll hear from two very important working programs that are answering the call, lifelines for Indigenous communities. We're so grateful to hear from our esteemed guests at Wabanaki Public Health and Wellness, and then also our folks over at Volunteers of America, Western Washington. And so, next slide, please. We will, please do feel free to put your names in the chat. Any questions that come up in the chat, guys, we will hold time for the end. But if there's any organic questions that come up, we'll be sure to field them to our presenters for today. So if you will, please do, like Oscar has done in the chat, thank you so much. Put your name, your tribal affiliation, if applicable, your organization, your role. We want to know who's in the house today joining us for this very important session. Next slide. All right, and with that, we are so grateful to welcome a team of folks from both the Wabanaki Careline, and then also to our folks from the Native and Strong Lifeline. So first we'll hear from Sandy Joy and Bentley Davis about the work that they're doing and how they address the needs of their communities and those in their area. And then we'll turn the floor over to Dr. Jeremy Rouse and Skylar Nomi to share more about the work that's happening over at Native and Strong and what that effort looks like. And so we're so grateful to have them. Please join me in welcoming, and I will turn the floor over the next slide to our team over at Wabanaki Public Health and Wellness. Thank you so much, Sandy and Bentley.
Thank you. As Daysher said, my name is Sandy Joy, and I am the manager for the Wabanaki Careline. I am not a tribal member. However, my son is a member of the Woodstock Band of Maliseet First Nations people right over the border in New Brunswick, Canada. And I have been involved with the community for about 35 years. Next slide. Okay, so what is the Wabanaki Careline? So I want to start out by saying that Wabanaki is a confederacy made up of 5 tribal communities in Maine. And so we serve the 5 tribal communities and other tribal members, those people that are living off reservation. We're located in Bangor, Maine, and our tribal communities are roughly, we have one up about 10 miles north of us here, and then the other 4 tribal communities are well over an hour's drive away. So our northernmost community is the Aroostook Band of Mi'kmaq Indian, and they are 3 hours away. So we are in a rural section of Maine, and we have to travel long distance to get to some of our tribal citizens, but we do have an off-reservation, population, and many of them living, in the Bangor area. So we do have a crisis. We have our crisis hotline, which is 365 day 24/7 hotline, and we have a mobile crisis response when needed. So people call us for a variety of reasons. Sometimes they are in a true mental health crisis, but we also take calls from people who are looking for a resource, and sometimes they're in need of services from one of our many programs that we have at our organization. So we do have a detox. That's our Cedar Road detox. We have youth programming, like it says on the slide. We have tribal home visiting. We have couple of mental health liaisons that are in 2 of our tribal communities, like I said, that are north of us here. So the Careline, when people do call the Careline and they're looking for a resource, we are able to oftentimes link them to one of the programs that we have at the Wabanaki Public Health and Wellness, our tribal public health. So the Wabanaki Careline started in August of 2020. Actually, we were in operation a little before August, but we officially um, were established in August of 2020. And we were able to do this with a SAMHSA emergency COVID grant that was awarded to serve people with serious mental health and substance use co-occurring, people with less than serious mental health, and any providers that were struggling with, providing services during the COVID pandemic. And we had 10 staff at the height of our Careline during the first 3 to 4 years. We had a staff of 10 members who answered the Careline. That also included a dedicated mobile crisis clinician. But we had a staff of 10 who were available, like I said, 365, 24/7. There was always someone to answer the phone, no matter what time of day or evening or night they called. But however, due to, funding cuts or the completion of our grant, we are currently operating with 2 staff members who cover the Careline 24 hours a day, every day, every weekday, and again, every day of the year. And I happen to be one of those staff members. So anyway, I did have to let my coworker supervisor know that I cannot answer the phone if it rings while I'm presenting right now. So anyway, it is a bit of a challenge, but we're making it work right now. Next slide, please. So I want to talk a bit about our mobile crisis response. And we had a mobile crisis team. We had a dedicated mobile crisis clinician. Unfortunately, very sadly, our mobile crisis clinician passed away in September of 2025. And of course, we're very saddened by that. We miss him tremendously. And he was someone with a great deal of experience. He had worked as a mobile crisis clinician for another organization before coming over to us for about 30 years. So I say this, with a heavy heart because he truly was a wonderful, wonderful man. And he would, he located here in Bangor, and he thought nothing of, if we had a community member in crisis in our furthest northern, tribal community, like I said, which was 3 hours away, he thought nothing of just hopping in his car and driving the 3 hours north to, meet with the folks that were experiencing a mental health crisis clinician, and following up with those folks. So he really was dedicated. Anyway, so as I just said, if a call came in or when a call came in and someone was in a mental health crisis, we would activate Kerry. He was our mobile clinician. I alluded to this a little bit earlier that we have 2 mental health liaisons, one in each of our Passamaquoddy tribal communities, and they can respond when activated by tribal police. So the Careline acts as sort of a dispatch. If there is a mental health crisis in one of these 2 Passamaquoddy tribal communities, tribal police call us, tell us about the situation, give us some details, give us permission to call the mental health liaison to activate them. And then if it's safe to respond, they will go to that person in crisis. And so that's worked pretty well. Um, and for those instances when we're not able to respond, say we can't, like right now, and I'm going to talk about that a little bit later, where there's only two of us who are working the Careline. Um, it's difficult for us to respond when there is a mental health crisis in one of our rural communities. So when we're not able to respond, we contact the main crisis line. So the main crisis line is the state contracted crisis service provider for the state of Maine. And we connect that person to the main crisis line. We stay with them. Sometimes we're on a three-way call. If we're not on a three-way call, we're checking in with them frequently. As the person in crisis is going through that process with the main crisis line mobile crisis team. The mobile crisis team will go out and to do, an assessment and evaluate whether they're meet the criteria for if that particular situation meets the criteria for admission to a crisis service unit, a CSU, as we call them here in Maine. And we have, I think, 5 in Maine in the different districts. We have 5 CSUs. And, once we get people connected either with our mobile crisis clinician or through the main crisis line, once we get them connected to whatever services that they need, we follow that person through crisis stabilization. So it's not a one and done. We do follow-ups, and we follow and we link them to a program, one of our programs, if that's what's needed, or something, outside. Next slide, please. So this is some of the work that we did while we had a 988 Tribal Collaborative grant from SAMHSA, and that I think started in 2023. And the goal of the grant was to improve response to 988 callers that were originating in tribal communities. So with the SAMHSA 988 grant, we built relationships with the main crisis line folks. They are the 988 contractor in Maine, and anyway, so we work to build a relationship with them. What we did was the way that we did that was by inviting the main crisis line staff to do a site visit for at our organization. They came in, they were able to see the Wabanaki Careline, the operations, how it was set up, meet the staff. And also we gave them a tour of some of the other programs that the agency offers. So they were able to have a better understanding of what we provide, what our programming is, and how the Wabanaki Careline functions. One thing we did is to create a cultural humility training, and we did this so that the statewide crisis workers could have a better understanding of the Wabanaki culture, the history, and the culture. And that was disseminated and sent out, we're still in the process of doing some of that, sending that out to the crisis workers in the state. So people that take the calls, and also the mobile clinicians that go out in those more remote areas that we can't always get to. Another thing that we did to build relationships with the main crisis line 988 provider was to create a policy and procedures for identifying Indigenous callers and then transferring the calls when appropriate to the Wabanaki Careline. So if a Indigenous person called the 988 or the main crisis line, they weren't aware of the Wabanaki Careline, they called, and the main crisis line, one of the procedures was to ask, they were kind of clued in some of the language, right? Some of the wording, maybe some of the phrases that might, clue them in that they might be talking to an Indigenous person. They could come out and say, "Are you, a tribal member?" And if the person identified yes, then they were told about the Wabanaki Careline. We'll go into a little bit more about the policy and procedures, I think, on the next slide. So next, please. So the policy, so when the main crisis line crisis call specialists, they're trained to support callers experiencing different types of crisis. So that's of course, the training that they get through the state. And the crisis line callers are looking for culturally specific resources and support for community members. The CS could refer callers to the Wabanaki Careline. So if identified someone as Indigenous, they could, like I said, ask them, do you want to tell them about the Wabanaki Careline, who we are, ask if they want to be transferred. Or in some instances, they might just be looking for a resource. So the main crisis line crisis call specialist, I'm getting everything confused because we call our crisis line folks who answer the Wabanaki Careline a little something different. Anyway, so when a caller calls the crisis call specialist at the main crisis line, sometimes they're able to direct them to a specific resource for Indigenous folks. And next, please. So I'll go into a little more about the procedures. So the main crisis line and a call comes into 988, right? Or directly to the main crisis line. Their crisis call specialists will screen for tribal affiliation by asking the question, are you an enrolled tribal member? And if the caller identifies as a tribal member, and if they're in the state of Maine, then they will provide the following description of the Wabanaki Careline. So I do want to say that we will take calls from any tribal affiliation. If that person finds himself in the state of Maine, right? They're here in the state of Maine. They're not a Wabanaki, a member of one of the Wabanaki tribes, but they're a tribal member, any tribe in the United States, we still will help them. So I do want to add that. So the following description about the Wabanaki Careline will be read to the caller, and if the caller is wanting to be transferred to the Wabanaki Careline, they'll do the main crisis line or 988 folks will do a warm handoff. And if let's say someone is talking suicide, then of course they're not the call specialists at the main crisis line will use discretion about, are we in a place where we can say, hey, right? Do you want to talk to someone at the Wabanaki, Careline? And chances are they're just going to keep working with that person and advise them about our services later on. So when appropriate, they will do that warm handoff. Next slide, please. Okay, so what we did is we created a directory of tribal resources for the statewide crisis providers. So if a call comes in and the statewide crisis provider in 988 is just merely wanting to provide them with a resource, they have a name of a resource. The statewide crisis providers have a directory of resources for each of the 5 tribal communities. And when appropriate, we do want them to call us, have the caller, get in touch with us so that we can, when appropriate, like I said, take over the call and work with the caller to connect them with the resources that they need. So because we work so closely with, the 5 tribal communities that we serve, that we have, some of the insider knowledge about, who to call for one, if someone needs after hours services from one of the tribal health clinics or behavioral clinics. Oftentimes my supervisor, who's been at this for a long time, she knows what staff person to call. So we have that ability for after hours emergencies, situations to connect callers. And we have found that people truly respond when they're interacting with someone from their own culture. So when we had our full staff of 10 people, we had one person who lived in one of the Passamaquoddy communities, but those 2 communities are fairly close, located fairly closely together. So so she was familiar with both communities. And of course, she was a member of the community, and we had someone who was a tribal member of the Mi'kmaq community, northernmost community. And we also had someone tribal member Passamaquoddy, who lived in Portland, Maine, which is, I think, Maine's largest city, southern Maine. She grew up with the culture, lived in Portland, Maine, so she would respond to people who were living in off-reservation urban area of Portland, Maine. So we had some tribal members who answered the call. Next slide. And another thing that we did to help make our help our Careline to be successful, and which was also part of the 988 Tribal Collaborative Grant, was to build relationships between the State Office of Behavioral Health. And I know I've done presentations with other grantees all across the U.S. And this seemed to be one of the kind of like sticking points, one of the more difficult activities that some of the tribes had, was how to build relationships with their state folks. Next, please. Sorry about that. All right, so the way we did this is we attended bi-weekly meetings with the statewide crisis providers. There was a bi-weekly meeting that happened with all statewide providers. Even though we are not a statewide provider, we're not a contracted state provider, we were still welcome to join the meetings. So we had a presence at the meetings. So people got to see us, and oftentimes they had, would have questions for us, but they got to see us. So we became familiar at these statewide crisis provider meetings. We developed a relationship with the 988 and Crisis Systems Reform Manager. This is the woman at the state. We had meetings with her to discuss, the activities and that were written into the grant. So we were able to build a really good working relationship with the manager. She was the project manager for the 988 crisis response grant.
We should probably go to the next slide.
Okay, so what we are doing now. So despite our funding cuts, we are still active, like I said. And on average, we take in 63 calls per month. Many of these are follow-up calls. And again, we have the two staff, myself and my supervisor. We provide mobile crisis response when we can, depending on the location of the caller. And we do have access to the mental health liaisons on a more limited time right now, but anyway. So we do what we can when we can, depending on the location. We talk to the person in crisis, stabilize as much as we can, and refer them to the appropriate resource. And oftentimes those resources are programs that we have within Wabanaki Public Health and Wellness. We also follow up with the caller as needed. So we'll follow them through stabilization and then even beyond oftentimes. And again, we have relationships with local and state crisis providers. And then next slide, I think I'm done. Yeah, so thank you. I'm sorry I went over.
No worries, Sandy. Thank you so much. Let's give Sandy a virtual round of applause as one of the two of the crisis line or care line workers that just, your dedication to this work and serving the people in Wabanaki, in Bangor, and in Maine as a whole. As we get the other slides brought up, I love the emphasis you placed on the relationships and the need for partnerships, right? So that you guys could catch or really tailor your work to those who maybe the state couldn't assist, but then also too, it's that back and forth partnership where if the state or the 988 office couldn't assist, then you guys were there to answer the call. And so I love the partnership and kind of working through that. I think we are ready to pull up our next slides. We did have a couple of questions, but we'll wait until the end to see if we have time to address those. Aaron, are you able to pull up, or Jeremy? Thank you. Lots of thank yous in the chat. And then maybe while we are getting those other slides, I think the question was, are there opportunities for volunteerism at the Careline, Sandy?
Not right now. We haven't really set up a way for people to do that, with a job description and
For sure.
anyway, no, so not at this time.
Sweet. Alrighty. Well, I will go ahead. Thank you so much, and turn the floor over to Dr. Rouse and Miss Nomi.
Right. Uh, Hello, everyone. Well, it's morning over here. Good morning, good afternoon, wherever you're at. Hamitakiapi chante washtena pechuzape yuha tayawa chiang kapido dako chaje kin shungsapokyan hemie kawashichu chaje kin Jeremy Rouse achaje mayatapi hangtuan nakoto yate hemacha. So greet you in my language. It's good to see everyone. Um, My name is Jeremy Rouse. I also gave you my Dakota name, which is Shung Sapa Kya. I'm Ihangtuan Nakota. I live over in Washington State, but my people are located in southeast South Dakota along the beautiful Minnesota, the Missouri River. Glad to be with you all. I'll pass it over to Skylar real quick to introduce herself before we move on.
Hello, all. Good afternoon, good morning, everyone. My name is Skylar Nomi. I'm one of the Native and Strong chat and text coordinators. I'm Oglala Lakota and Nez Perce descendant. Really happy to be here with you all today and hopefully answer some questions and shed some knowledge and connections.
Thank you, Skylar. So I'm the Travel Services Program Manager at Volunteers of America, Western Washington. And so I want to talk a little bit about the work that we do specifically on the Native and Strong Lifeline. There's some other programs that we also manage within Tribal Services, but focusing on the Native Strong Lifeline, both our phone modality as well as our chat and text that Skylar will really get into. See if my slides will go forward. There we go. So just wanted to share a little bit today about kind of how the Native and Strong Lifeline came into being, some of the best practices that we found working on the line to connect with our relatives who are calling in, how we're serving our community, and then of course, give space for any questions that you all might have. So our lifeline, again, both our phones and chat and text is 24/7, 365. Is actually the first statewide suicide and crisis hotline specifically for Native people and operated by Native people. So we're really proud of that. And it came into being. It was founded or it launched in November of 2021 or 2022, excuse me. And that really came on the heels of state legislation that allowed a telecommunications tax. And within that legislation, there was money that was earmarked for culturally and linguistically appropriate services. And so that's where Native Strong came in and was able to start up Volunteers of America. Western Washington ended up being the organization that kind of stewards that program and took responsibility for that program. And what else did I want to say about that? So that's kind of the basic, the bare bones of kind of how things got started. Of course, there was a lot of advocacy, boots on the ground work to sort of rally people around that idea to get things into place and organized. But that's kind of how it came into being in terms of through legislation, through that telecommunications fee, and that's still how it's funded now. There's some additional grants and things that funnel in here and there, but primarily that's how we operate. So we're contracted through HCA and work with DOH and HCA to operate our services within Washington State. And so again, kind of first of its kind as far as a statewide service that's 24/7, 365. It is part of the Washington State 988. We're a subnetwork of that. And again, the unique thing about us is that we're really proud of, and that we really take seriously, is that we're operated by and for Native people. And that's from our leadership down to our counselors within tribal services. It's all operated by Native people, so that when one of our relatives calls in, you're going to get another Native person on the line, and we think that that's really important for a number of reasons. There's this sort of like cultural continuity and just the life experiences to be able to understand what people that call in are going through and experiencing. I think there's a larger piece of this too that relates to sort of just our inherent rights as tribal people to care for one another. And Hunter in the beginning brought up sort of some of the historical legacy, right? Why do we find ourselves in the situation that we find ourselves in with high rates of suicide in our communities? And a lot of that has to do with ways that our ability to care for one another we're impaired or taken away. And so really wanted to get back to that where we're taking care of our own communities when they call in. And so we're really proud of that. And that's a really important principle that we operate on. How it works is that anyone who and so chat and text works a little bit differently from phones as far as who can access us. With phones, it's anyone with a Washington State phone number. They call into 988. They get the sort of phone tree and they select option 4, and that connects to one of our counselors. Skylar will talk about it a little bit, but chat and text a little bit different in that like it's based on anyone within the geographical boundaries of Washington State gets connected through our chat and text. And that just is like on the technology end of things that I don't fully understand. We have a contract through Vibrant who sort of manages all of our phone and chat and text technology. So for whatever reason, again, not a tech person, for whatever reason, that's sort of the limitations of the different modalities. Our crisis counselors do answer every interaction by sharing their tribal affiliation. And that really comes from, and I'm sure the Wabanaki folks can kind of speak to this too, and shared similar experiences where, especially in the early days when it was getting going, and it continues a little bit today, but some sense of like, is this real? Are real human beings answering the phone? Are they really native? Just a lot of that maybe apprehension in our communities, and just lack of it's a new service being unfamiliar. And so that was just a really simple way, really practical way to just sort of break down some of those barriers to let people know who it is that they're talking to, that they are talking to another Native person to sort of build that affinity, build that connection and rapport right off the bat. So that's one of our practical, just everyday practices of answering each interaction where the counselors do share their tribal affiliation. And our counselors are really all over the place. Washington State is a really diverse place in terms of our tribal population. There's 29 federally recognized tribes within the state. And of course, literally hundreds more of people who have, Seattle was a big hub for relocation in the sort of when that was formal policy, even now more in a more de facto way. There's still a lot of people that, come to Washington State from other tribes, from Montana, from Idaho, from Oregon, from, even myself, right? Like South Dakota tribe living in Washington State. And so we've got, large urban centers like Spokane or Seattle, where we get a lot of people who are living away from their homeland. So a very, very diverse tribal population within Washington State. Again, both because of the number of tribes that are here, but also, again, a lot of that migration, that diaspora really from our tribal communities. And so we try to make sure that our counselors kind of reflect that. And there's kind of two reasons for that. One is, again, just to reflect the diversity of our tribal population in Washington State. But also a lot of the feedback when the line first started was that folks don't necessarily want to call someone who might be in their own community, right? Might be a cousin, might be an auntie, might be a neighbor. If they're going through certain challenges, going through a difficult time, they might not necessarily want someone who might recognize them, might know them. And so that's also just reducing the chance that might happen. So we do have counselors who are in Washington State, but we also have people who are in Nevada, California, Arizona, Montana. They're really spread out throughout the U.S. And so that's really great to just kind of have that diversity in our counselor population. And actually chat and text. Skylar, you want to take it from here, and I can pick it back up whenever you're ready.
Yeah, absolutely. So our Native and Strong Chat and Text launched recently in August 25th of 2025 last year. So we've been operating for a couple months now, and it has been really great. Similarly to the Native and Strong Lifeline number, the option 4, we are also available 24/7, 7 days a week, 365 days a year. It's just an extension of the team itself, and they are just able to talk to our visitors in a different way. And so we wanted to make sure, especially with the younger generations, or just communication preferences, we're in a new modern, day and age. And so expanding more ways for more support was really the goal. And so you are able to text native to 988, and it will also, based on kind of how Jeremy touched on, based on what your cell phone pings off of and your telephone number and all that logistical things, it will reroute you to one of our clinicians. Or you are able to go to chat.988lifeline.org. It will prompt you to enter in your zip code, and that is, once it recognizes that it's a Washington zip code, it will pop up with the option to connect with one of our tribal crisis coordinator or clinicians. So since then, since launch of August 25th, we have taken over 3,600 chat and texts from all over Washington, every county, every city. It has been such a great thing to see it blossom, again, especially with our younger generations and just, our relatives who like to maybe chat versus talk on the phone, or making that step is really challenging. There's a lot of things that prevent reaching out and wanting that care, that support. And so sometimes it's easier not to have that so directness of the line. So that chat and text option is really, really great to have. And currently, we do have 20 tribally affiliated clinicians helping our relatives 24/7, 7 days a week, 365 days a year. Next slide. Okay. And so there's, to kind of give a background about our counselors understand when our visitors call us or text us or chat us that it's on a really big foundational level. This is kind of some tips that we would like to just pass on, or if you're wondering if this is something that you could bring to your state or anything like that. These are the things that have helped build this foundationally, piece by piece, be able to have us expand and really build that support and that trust within our communities. It's really not to rush anything. Naturally, we communicate more slowly. We take our time with our words. We find that in silence is connection sometimes. And in the modern day, in today's day, everything's so rushed. Everything's so fast. And so that can really deter someone from getting that support if they feel like they're rushed or they don't maybe know how to get it all out. So again, this can look like adjusting your speech, waiting for a longer response as they could be thinking of what to say. Again, that silence is really that connection piece. Trust does take that time, and rapport doesn't keep coming easily. You have to keep showing up no matter what. We don't define anyone's crisis. We meet everyone where they are, and that looks different for everybody. And so I think that's a really big piece to remember, that it's really just about building that trust. Like I said, our communities have a lot of trust in state programs as it is. General historical trauma, generationally speaking, it can be a lot. And so it's important every step of the way to remind them that you're there and you're wanting to listen, and we'll sit with them and meet them where they are, even if it is just silence. If if you've heard you have some Native ancestry, it's really not the time to share it. We remind our clinicians, and just, it's not about us. Our whole entire demeanor, our attention is always focused on the relative that we're helping, and it's just about sitting with them. That's it. There's nothing, more or less. It's really sitting with them in that uncomfortability and that raw vulnerableness. some of our Native people do spend all of their lives on the reservation, and that can cause, isolation from outside. So it can be different. It's a different world that some of our relatives can live in. And so keeping that also as a reminder, Native people are the expert, and a lot of us, we know what we need. They know what they need. It's connection and validation, and just someone to witness our stories and experiences and to hear what our life is, and really sit in those moments. Another thing is, don't try to control the conversation. Leave the room for the person to speak and tell their story. Ask open-ended questions. Help. Sometimes it just takes a question that could be, removing that rock to the waterfall that they've held onto their whole lives, and it could save their life that day. So just make sure to, always step into conversations with everyone. I know this says all clients, but just everyone, just a reminder that nobody needs to be fixed. They need someone to walk beside them while we all heal. So listening is the biggest piece that helps our line and day to day. And this is also just, again, a few things respecting culture during calls, chats, texts. Reaching out can be hard, especially from tribal lands where trust in systems may be very, very, very low. Our Native and Strong counselors listen without judgment and respect. A lot of them have lived experience. A lot of them have really deep personal connections to their communities, and so they understand. They also understand the impacts of the history and the intergenerational trauma. And so every call, every text, every chat is answered by an Indigenous counselor who knows what it means to walk this path. And so, like Jeremy said too, to echo, like, we really, really, really do take pride in our whole program being fully staffed by Indigenous relatives.
Thank you,
Next
Skylar. And I
slide.
know that we are coming up on time, so we are happy to kind of pause there and leave space for a few questions in the last few minutes. I'll stop sharing.
Thank you, Skylar. Thank you, Jeremy. We did get a couple of questions that come through. One is submitted through the Q&A box. Is 988 option 4 available for Alaskans?
It is not currently. Right now, it's only available in Washington State. I know that we've met with a few people in Alaska who have been trying to get something going up there. That's something we do a lot, is like people reach out to see, how did you get this going? How are you doing it? I know there's efforts underway in Alaska as well as in California and Oklahoma, and I'm sure other places as well. But right now, yeah, we only operate in Washington State currently.
Alrighty. I think there was a question for you, Dean, but then there was also a second one from the team. What about those who don't have access to connectivity? That was a question posed in the chat. And I don't know, Maria, if you want to come off mute and kind of elaborate a little bit. All right. We also got another question in the Q&A box. Do you consider yourselves warm line, allowing non-crisis calls or only for crisis?
Okay, there we go. Sorry. Um, when I say about those who can't reach connectivity, we put out a bunch of QR codes and stuff like that. But so many times, especially those who are in crisis or whatever, they either lost their phone, got it stolen, it's broken, or they simply don't have access to Wi-Fi connectivity or or even a phone. So what about those people? That's what I'm talking about.
Thank you, Maria. Is that for our team at the Wabanaki line or for Native and Strong? Or either?
For both.
Yeah, I think for us, yeah, and I think that's a struggle as far as especially there's a lot of really rural and remote areas in Washington State, and that connectivity piece is definitely a challenge. Um, I mean, in terms of yeah, we don't have a way to intervene if they're not able to access yeah via chat, text, or phone. We do try to partner really closely with other state agencies with tribes in order to coordinate crisis services. Or to be able to refer people to services.
Is there any way, I'm the tribal consultant for our federal Lifeline. I've been contracted through True Connect. I don't know if you guys have heard of them, but if you'd like, I'll put down my contact information in the chat and I have no problem with coming out and sitting down and having a visit with you guys, and I could figure out a way on where we could establish where you guys are issuing out the phones to those members who need it, or something along those lines. There's opportunity for me to bring in the federal lifeline services into our local tribe, or not just our local tribes, any tribe within the region. I know that we're focused on federally recognized tribes, but even if you're not federally recognized, I will work with you to make sure that your tribal members are getting everything that they need, as far as what the federal lifeline services can offer you. And then I can also offer something called the AMP program, where your facility can actually be issuing those services, and you would be able to generate an income from those phones that you are activating. You generate an income for the next 90 days for your agency, and that income is actually income for you to use at your disposal. You could do whatever you want with it. They're not restricted funds, is pretty much what I'm saying. And so I'll put my information in the chat. And again, I'm the tribal consultant for the federal lifelines throughout the whole nation, and I could travel to any tribe within our nations and bring these services to you guys, if that would help.
Thank you so much, Maria. Yes, please do put your information in the chat. And so grateful for everyone to stay on just a few minutes afterwards. Want to thank our session presenters again for sharing the knowledge and the amazing work that's happening. And we will share the slides with everyone. So just want to thank you, Sandy, Bentley, Jeremy, and Skylar for joining us. There's never enough time to share all of the goodness, but so grateful for you all to join us today.